This meeting is being recorded. Good morning, everyone. This is my meeting with you about what is now being known as, because it's morphed a little bit, the Coronavirus Small Rural Hospital Improvement Program. Chris, did you have something you needed to say? I keep seeing Chris Gordon, did you have something you wanted to say?
I'm good.
Okay. Okay. So a couple of just really quick housekeeping tips. Everyone should be muted. If you move your cursor down to the bottom left-hand corner of the screen, that's where your microphone is. When you want to say something, you can just take yourself off of the microphone. Next to that is the video. That's an example. And so you're welcome to turn on the video if you would like. I know some people don't feel comfortable. It is cool when we all have on our videos and we can see each other. However, I understand that not everybody has a camera. Along the bottom of the screen, then, we have a new thing, which is security, which is something that we also need to just briefly talk about. There should be some participants. There's the chat room if you want to chat. And then there's reactions. So if you have a question, you can put up your hand, or you can just put something in the chat box. The purpose of today's meeting is to talk about the Coronavirus Small Rural Hospital Improvement Program. Since we first started doing this, a lot of new developments have happened, and I realize a lot of things have probably shifted at your hospitals as well. Can just maybe Rochelle, can you see my screen? Just hopefully everyone.
Yep.
Okay.
Yeah, I can see it.
So this is kind of a brief agenda of what we're going to talk about today, and I do want to respect all of your time, so I'll go through it not too quickly because I want to make sure all questions are answered, but I will try to get done within 45 minutes. The first thing I want to just mention to all of you, and Rochelle and I were talking about it earlier, the Wyoming Health Department has moved from the CenturyLink building in Cheyenne into the Hirschler building, except the Rural and Frontier Health Unit. We're in a different part of the Hirschler building, and then the coronavirus hit, and so we have not moved yet. However, we are moving, and we do have a new address, and you'll see that new address reflected on the grant agreement. The second thing I want to bring up is I did have a conversation just briefly with Mark Lyons of KC Peterson yesterday. And as you know, many of you are working with Mark. I'm working with Mark. I'm very grateful for his help. One of the things that he was very adamant about was cautioning us on the federal funds that are coming in, because we're not necessarily aware of what all the consequences are. So just like with this coronavirus SHIP grant, new information just keeps coming in, and the same thing's happening with a lot of the other funds. And so I'm going to take his advice, with some seriousness, that we want to be really careful. We want to go slow. We want to make sure that we're doing this right, because we don't know what the long-term consequences of taking some of these funds are, or what it looks like. We've actually received false information, so we all just need to be careful. The next thing I want to talk about with the SHIP grant and then the CSHIP grant is something that we've all done, and all of you have done it. And if you haven't done it, you haven't done it, and we can talk about why you haven't done it, but that's the risk evaluation. So we've done the risk evaluation. I have them all in there. I want to thank you all for that. And again, if you haven't done your risk evaluation, you haven't. That's the risk of, what we know right now is that we're all at risk, period. All of our hospitals are at risk of closure. So doing the risk evaluation is not a requirement for receiving the SHIP funds, but it certainly helps me move the process through. I think I have all of your DUNS numbers, which is another thing that I need. I think I have all of your Wyoming Department of Health vendor code numbers. For a couple of you, I may not have that information, and that's something that I'd like to just have a phone call with you about. So what happened? I adamantly, not only did I, but several people around me adamantly advocated for the Wyoming Hospital Association to work as our fiduciary agent to distribute these funds. It didn't happen. We could not get past the accountability piece. And when we talk about the accountability piece, I think we can all agree, and believe me, we fought hard for this. But we all know of entities, I can think of a couple myself just off the top of my head, who have not used federal funds in the way that they were intended. And because they did not use federal funds in the way that they were intended, our hospitals became at risk, our communities became at risk. And there were negative consequences for everyone because of it. So that conversation about being accountable for these federal funds is what finally persuaded me to say, okay, I will write 19 grant agreements. Not happy about it, but I'm going to do it. So similar to the SHIP grant, when we do the SHIP grant, and all of you that participate in the SHIP grant, you're aware of this, there's an application that goes out, you fill out the application, you return it to me, we write the grant agreements. The governor has firmly expressed to the Attorney General's office that they need to expedite these. I'm going to say that if you want to talk to somebody about it, you might want to go to Director Sabias. But at this moment, we're writing the grant agreements. So within the grant agreements, there are two different ones. And again, you guys know.
Don't I tell you if I'm going to be on a video?
I'm sorry. What? What? Please make sure that you're muted. It's down on the lower left-hand corner of your screen. I forgot where I was at. Okay, so we know that we have two different entities. We have the government entity and the non-government entity. So there are two different grant agreements. For most of you, you will be doing the government grant agreement. It looks almost word for word, exactly like the SHIP grant agreement that all of you just got. So almost word for word, except that what's changed is the purpose. And the purpose of this coronavirus SHIP grant funds is to prevent, respond, or prepare for the coronavirus. And so I'm going to go over that with you. So then in the grant agreements, what's different? What's different is that insurance clause. So if you are a non-government entity, then we have this insurance clause, and the only two things I'm requiring are the commercial general liability insurance and the cyber liability insurance, especially right now when so much of our work is going online, and we risk having, and we know we have having a cyber attack. Now, the dollar amounts on both of these, if you already have these, but the dollar amounts are different, in an email back to me, just let me know that. Just be like, this is our dollar amount, and I will change the grant agreement to match what your dollar amount is. But the important thing, if you are a non-government entity, is to be able to provide proof of this insurance. And some of you already have, and if you have, I've got it. And if I don't have it, then I'll reach out to you and let you know. The other thing for the non-government entities is the certificate of good standing from the Secretary of State. Now, this is really important for me in writing the grant agreements, because the name on the grant agreement has to align with the certificate of good standing. So if those two don't match, then it gets kicked back to me. So I can get your certificate, that's not a problem, but I need to make sure that the name matches. So when you fill out the application, make sure that your name matches. For government entities, I don't need that. That's not a requirement. Take a drink of water here. Warm water and warm coffee. If you're not drinking it, it warms the soul. All right. Really briefly, I want to talk about QHI, the quality health indicators. In QHI, for the critical access hospitals who are on the call, so if you're a critical access hospital, you know that we agree to report this financial productivity data into QHI. I want to really encourage you to report that data now more than ever. And Rochelle is on that. She's looking at our QHI stuff. She's looking at what we can still do as far as quality improvement, and certainly what we need to be doing around financial stability and financial improvement. So that's my plug to please take some time to make sure that you are uploading your financial productivity benchmarking data into QHI. I want to be able to tell this story when we get past it. All right. So what we get from HRSA? Let me see. I should have it. Hang on. Give me 1 second, and I will get the document that I need to share with you. Okay, on my screen now should be the fiscal year 2020 coronavirus SHIP frequently asked questions. Can someone let me know if they don't see it? All right. This is the most recent document that we've gotten from HRSA. In the email that I sent to you guys, it is one of our attachments. We are using this then to make a clear statement of what we're going to use these coronavirus SHIP funds for. And so you're welcome to read through it, but the point that I want to get to is this right here, example of all allowable uses of funds, because this is exactly what we're using. The allowable uses of funds include ensuring hospitals are safe for staff and patients, detecting, preventing, diagnosing, and treating COVID-19, and maintaining hospital operations. Underneath those three things then are the whole list of what you can use this coronavirus SHIP funds for. Under response, detect, prevent, diagnose, and treat COVID-19, here is the full list of what are acceptable for you to use coronavirus funds for. And then maintain hospital operations, right? That is the document that we're using. So in that then, each one of you will receive, they are attached to that email that I sent out. So on that email that I sent out, you will find this, the Coronavirus Small Rural Hospital Improvement Program grant application. In this grant application, the first paragraphs tell you a little bit more detail about what is acceptable and what is not acceptable. On here, I need you to put in your legal name. Please put in your name exactly as it needs to appear on that grant agreement. And for those non-government entities, it needs to match that certificate of good standing. In the next section, and I'm getting a beeping, so if I cut out on you guys, I am so sorry. I'm not sure what that beeping is for. On the next section, you will find just this, you know what, you can edit it if you want to, but, well, you can't edit it, but you can fix the formatting. All right, the next section is the actual dollar amount and the actual activity part of the application. So again, it just goes to safety. Hospitals are safe for staff and patients. Tell me what you're doing, tell me how much money you're going to spend, and tell me the date of completion. Remember that you have these funds until September 1st of 2021. So you have these funds for 18 months. If you're going to use the funds to respond, detect, prevent, diagnose, and treat COVID-19, put that in there. And if you're using it to maintain hospital operations, put that in there. Put the dollar amount in there and put the total amount in there. There is some conversation still happening at the governor's office about how much money is actually going to get dispersed. I have not heard back yet. And believe me, we're advocating that all 100% of this funds gets dispersed to the hospitals. That's everyone's intention at this moment. I can't imagine they're going to say anything different. Although if they decide they want to take out indirects, I'll fight it. I will fight it. Okay, I'll fight it. So that's page 2 of the application. Page 3 of the application, there are 3 questions that you have to answer. One is, will the hospital provide supporting documentation of the use of the CSHIP funds to the program manager within 30 days of request? So examples are invoices of purchases of supplies, invoices for purchase of equipment. If you use this money for payroll, then just send me, like, this is who we paid, and this is how much they got paid. The second question is, does the hospital anticipate reserving a portion of the CSHIP funds for ensuring safety, responding to the coronavirus, or maintaining hospital operations? So you may get this money, you may say, we don't need to use all of it right now, but we want to hold it because we know we're not out of the woods. We don't have a vaccine, we don't have enough testing, we don't have a cure, something could happen. So we're going to put that money in a separate account, and we're going to hold on to it for 18 months. So if that is part of what your plan is, then this next question is, if yes, does the hospital have an accounting system set up to manage these funds responsibly, ethically, and in accordance with the purpose and intent of the CSHIP guidance? So again, that goes back to the risk evaluation. One of the things we ask on the risk evaluation is, do you have that accounting system set up? Because we know that you're going to be getting different grant funds. And with each one of those grant funds, you need to have a separate accounting system in place, a separate line item for each one. And you know, a lot of you have been working with you guys for a long time on that, to make sure that your grants do have that separate line item for each one that you're receiving. And that's going to be really helpful for everybody in the long run. So if you want to hold on to the SHIP funds for 18 months, you can, but just let me know that you have an accounting system in place. And then of course, the last thing is I need signatures. I'm still in discussion about accepting electronic signatures, but this is a very similar application to what we've done all the time. We do it year after year with the SHIP grant. And so this isn't any different from that. And then of course the grant agreements. So in the attachment, or in the email, I also attached the grant agreements, and you want to be very careful, because there's the non-government grant agreement and then there's the government grant agreement. So make sure when you're reviewing these that you're looking at the right one. Do not do anything to the grant agreement. I will fill it in, and I have people around me who we're going to do our job and get these grant agreements done. The only thing I need back from each of you is your application. So don't send me anything other than the application and the words, we're okay with the grant agreement, or we're not okay with the grant agreement, and here's why. That's it, I think. I am open to hearing from all of you. You're welcome to unmute yourselves and ask me any questions, comments, or concerns.
Hey, Kyle, this is Cody from Niobrara.
Hey, Cody.
Hey, I'm just calling to make sure, I see this is recorded. Are you going to be sending this out? Because we're going to jump on getting this done as quick as possible. So.
Yes. Do you need the recording?
Yes, just so that we make sure we get everything done and our T's crossed and our I's dotted. So.
All right. So I appreciate that, Cody. Yeah, I will send out the recording.
Awesome. Thank you.
You're welcome. It's good to hear your voice.
Hi, Kyle. This is Gina.
Hi, Gina.
Hey, I have a question about the indirect costs.
Yes.
My understanding was that SHIP didn't allow the indirect costs anyway. Am I confused on that?
Right. So so I've gotten conflicting information as well. The information that I've got, it says no, we don't take out indirects. And then I heard from a different group of people that yes, we do. And so My understanding is that we do not take out indirects.
Okay, that's my understanding too. So, okay, thank you.
You're welcome. All right, I see one thing here in the chat. Is there a preference for how we spend the money? Does choosing to use it for payroll lessen our opportunity? No. Let me make that clear. Does choosing to use it for payroll lessen our opportunity to receive funds? No, you're receiving funds. You're receiving funds. The only hang up at this point is how to get them out to you. And then in that discussion, this accountability piece came up, and I'm in agreement. Like, we need to be accountable. We need to make sure we're using the funds in the way that they're intended. I think all of us want to do that. Do we have an estimate of the amount we can apply for? $106,000. Is there a recommended amount we should request? $106,000. And I'll tell you what, as soon as I get off the phone, I'll start making my phone calls, and we'll solidify that. I believe the actual amount is $106,505.
Hey, Kyle, this is Trish.
Hey,
I just
Trish.
wanted to tell you thanks so much for all you're doing for everybody in our communities in the state of Wyoming. You look a little tired, girl, but it's good to see your face.
I'll second that, Kyle. Thank you so much. This is a lot of work, and we appreciate it very much.
Stay open. You guys just stay open. All right, hearing it, no other questions, comments, or concerns, I'm going to end the meeting. Thank you, guys. Thank you very much.
Thanks, Kyle.
You're welcome.
Thanks, Kyle.
Thank you.
We got
Kyle.
this. We got this. We got this, you guys. We got it.